Nurses of psych wards, what did a patient do that left you speechless? My aunt was a pharmacist in a psych hospital in Iraq. She told me that a family brought their son in. He was previously detained and tortured by Saddam's security. The young man was admitted as a severe case. He then started to hold imaginary trials and sentence people to death by hanging. One day they did find another patient hanged, dead, and the young man was standing next to him shouting justice was served. Jesus, that is fricked up. This was actually in a state hospital that is part of the prison system for mentally ill offenders. Patient asked for Vaseline, which is fine. They can have Vaseline, whatever. But this patient was given a whole tub, so of course he stripped completely naked, covered himself in Vaseline, and ran. It was a secure unit, and he didn't escape, but we couldn't get him back into his cell all shift because he was too freaking slippery. No more tubs. This might not fit perfect, but I love this story. How about in an inpatient addiction clinic? The first one that comes to mind was something I witnessed between a patient and another floor tech. We had a man who was in serious detox. Drug if choice was M. He was throwing a huge tantrum, not uncommon in DTs. People will do just about anything to get a fix. We weren't a locked facility, so it wasn't like he was stuck there. He genuinely wanted help. That's why he stuck around, and we were there to listen and help him through the shakes, hallucinations, and other symptoms. He was slamming his fists on the desk at this point, and he had started just yelling, "I just want some freaking ice," slang for crystal M. Well, the tech with me was inexperienced, although much older than me, and while I talked to him and tried to calm him down, she went back to our staff kitchen and got him a glass of ice, like frozen water. She brought it out to him and put it in his hand like, problem solved, and the guys just froze with confusion, staring at it. The patient and I both realized at the same time she thought he wanted ice, and we just started at each other and started laughing. He was in for a rough couple of days, but I've never seen someone jump from near psychotic episode to giggling so fast. I honestly would have done the same thing as the nurse. I was a CNA for about 4 years, and the saddest ever was my client resident constantly thought I was her daughter. She went to Harvard and was an extremely brilliant lady in her time. She was non-verbal, but every time I walked into her room she would exclaim, "Elizabeth, you came." I loved this lady so much. She would only eat when I fed her. She was extremely combative with everyone but me. I ended up quitting my job there but visited her every single day, to the point that her family kind of accepted me as their family. I finally found out that Elizabeth took her own life at 21, and the fact that she thought I was her gave her extreme joy. I never corrected her, and I like to think I gave her peace when she passed holding my hand. She was an amazing lady and I miss her to this day. Prison guard here. Guy cut his scrotum open to let people know he was serious. Don't know about what. Guy 2 cut off a butt cheek, or a big part of, and threw it at me as I tried to stop him. Guy 3 punched a wall 3 times really hard, bloody knuckles, and told me he punched the devil cause he was telling him to stab me, but I am cool, so he told the devil to frick off. Guy 4 pretended to drown himself in a toilet, basically splashed pee on his face and rolled around crying. Guy 5 had fricked a window air vent and was compliant yet confused when I asked him to stop. Those were the days. Guy 3 just a homie, if we're being honest. When I was in nursing school I had a clinical in the state-funded sick ward downtown. I was assigned to sit with this one girl to monitor her behavior. She spent about 30 minutes doing nothing but eating pudding cups with a plastic spoon. She ate like 6 of them in half an hour. Then out of nowhere she very calmly licked her spoon completely clean and pulled her shirt sleeve up before shoving the entire spoon into an incision in her arm near her bicep. Then very calmly said, "Ops." The nurses that worked there didn't believe me. They kept saying I was making it up and that I couldn't have seen what I saw. Only later on, like 4 hours later, it was a 12-hour clinical, the orderly noticed the girl had some blood on her shirt. He took her into her room to change her clothes and noticed that an incision on her arm had dehisced and had been bleeding. He then eventually agreed to send her to the hospital for testing. The x-ray showed the entire spoon sucked into the fat of her upper arm through an incision where they'd removed a birth control implant in the week before. Apparently the girl had slowly been picking at the sutures and opening it bit by bit until it was deep enough to fit an entire plastic spoon. The girl admitted that the ops was because it had gotten sucked in and couldn't be pulled out, not because she stuck a spoon in her arm. Totally bizarre. We had an older black lady who would walk up and down the ward constantly mumbling. It never stopped. I think she would get something like Thorazine to calm her down, but she would fight it and her eyes would be all droopy and she'd slow down, but she kept going. Nobody understood a word she said and she was there for at least over 6 months. She was punched out once by a patient while he was on the phone because she kept walking by ranting. He just lost it. Anyway, I'm up there doing a patrol one day. I was security, and she's ranting and walking up and down the ward as usual, and they call her to come get a meal. She sits down and opens her tray and stops ranting and states clear as day, "I didn't order no diabetic tray B." Every last person turned to her and all of our mouths were wide open. That was the only thing she ever said clearly. Years ago, I was a student nurse doing my psych rotation in a Catholic facility. The nuns still wore habits and the building was like something out of the Dark Ages. I'll skip talking about the line of patients waiting to undergo EC treatment in the basement and instead tell you about Maggie. She was a tragic case. She had been on lithium for years and it really kept her psychotic episodes in check until reached toxic levels and could no longer take it. One hot summer afternoon, we heard this banshee screaming coming from Maggie's room. We rushed in there to see what was going on. Entering the room, we are greeted by a scene I will never forget. This late 70s woman is standing on the window ledge, naked as a jaybird, screaming through the window screens at the nuns in the courtyard. "You fricking penguins are going to burn in heck." The poor sisters are scrambling to and fro trying to get away from the ranting madwoman's viscous verbal assault as we were trying desperately to pull her off the grating. I knew then and there that I would never become a psych nurse. I am a psych nurse and that story is so funny to me. You definitely need a weird, dark sense of humor to work in that specialty. Psych ward counselor here. Early in my career I had a teenage girl with suicidal ideations and severe depression. The year before, on Thanksgiving, her dad pulled a gun from under the dinner table and blew his brains out in front of everyone. I normally form a response pretty quickly, even a wow, but when she told me I got quiet, leaned back, exhaled, and had to gather my thoughts. Had a catatonic guy who could play the piano like a pro, classic, jazz, ragtime, but otherwise just sat in his chair and stared. Had a guy come in with pictures of families pasted on his feet because he wanted to be close to them. That's actually wholesome. We had a psych patient on our floor that wasn't really crazy, just really confused and unpleasant in general. One night I was mixing his drink with some thickener, and per usual he started yelling about me poisoning him. I explained what it was and that we're all here to help him, not hurt him, and he responds with, "I'm just going to die." His vitals were fine. He was alert, no red flags, and like I said, he was always pretty unpleasant, so I didn't think much of it. Sure as crap, he coded an hour later and we never got him back. My man said peace out and freaking faded. The commitment of the lad. Not a nurse, pharmacist. Had one of our clozapine patients miss a monthly meeting to discuss their medication. Called around. Found out she was in the ICU having eaten 2 of her own fingers, then visited her mother for coffee. Still bleeding. Had a friend tell me of another patient. Made a cut in his thigh and reopened it regularly until the whole thing was a scar tissue cavern. By some miracle avoiding infection. Started using his meat pocket to hold pens and coins and anything he could collect in his ward. Nobody knew until a paperclip pierced the side and he finally wound up with an infection that took him to ICU where they found his stash. Meat pocket. Jesus, dude. Not a nurse, but have had several stays on psychiatric wards for bipolar. To be fair, on most occasions, I didn't enter the wards in the most rational and stable state myself, but what has tended to happen is that even when they bring you back down to earth, you can end up staying for an extra month or 2 before they let you go. So I have spent some time on psychiatric wards completely sane, if not maybe firing on all cylinders. Anyway, I have seen a few shocking things, like a guy cutting open his wrists with broken glass and bleeding out pretty severely, but TBH, you quickly become desensitized. What tended to leave me speechless was the abruptness of certain behavior and its total incongruence with facial expressions, etc. For example, sitting watching a TV when a 5-foot-tall 7-stone woman calmly walks over, suddenly lifts the TV up and throws it into the wall with great force, smashing it to bits, and then calmly sits back down in an armchair declaring that the TV was ruining her painting. She wasn't painting. By making the armchair give her an orgasm. She never even raised her voice. She then immediately asked me, as if it was somehow related, if I liked Lisa Stansfield. Not me, but someone I knew was in a ward with a girl who wanted to be a vampire and drank blood from her own tampons. It's as atrocious as it sounds. She was around 16 and schizophrenic. When I was a student doing a placement in a maximum security unit, a serial rapist was getting meds, made a silly joke. The nurse said, "Oh, stop that." His response was, "I've heard that before." A nurse told me one of her patients killed himself on the unit while on one suicide watch. Patient and staff were at arm's length and patient suddenly charged the wall, smashing his head as hard as he could, breaking his neck in the process. I've cut 2 patients down myself. Yeah, that'll mess you up. I'm not a nurse but was a patient once. Giant dude got upset. One dude changed the channel from a football game he was watching and smashed his skull with his fists. Not fully, but enough that when they brought him back a few days later he started seizing and had to be removed again. Didn't see him again. Also, there was one lady who was straight out of the movies, walking around preaching the end of days loudly and sweating like crazy. I was a patient around a giant dude as well. The guy had an outburst but afterwards ended up being drugged to the point of needing the walls to help him walk and a towel to wipe his drool. That scared me more than the giant dude himself. It'd feel like a movie where once you go in they never let you out. When I was a teenager in a poorly staffed and not well funded mental hospital, there was a male psych nurse who traded contraband like drugs or cigarettes to teenage girls in exchange for physical favors. This is not at all uncommon in inpatient adolescent treatment. Not me, but my dad used to work in Arrowdale and J Ward, Australian insane asylum and prison for the criminally insane, respectively, in the 70s. He used to talk about sunny days in J Ward where they'd bring out all the inmates during a sunny day and they'd promptly line up and start jacking off. In Arrowdale they'd deal with the jacking off problem by strapping you into cotton mittens, but a lot of the inmates would chew a hole through them just to get a finger out to jack off with. His worst story was about a psychotic woman in Arrowdale. She had self-inflicted scars all over her face from scratching herself, self-imposed bite marks all over her body from trying to eat herself, and she had the nasty habit of chewing the inside of her mouth and spitting blood at your eyes and mouth hoping you'd catch one of the myriad of diseases she carried. I've worked with so many people who spit blood in your face when they'll pee. At first I was pretty impressed with the clever thinking, but now I just get annoyed that they're staining my clothes. I'm an RN in Boston in a psych hospital and I've seen some crap. One of the things I'll never ever forget was we had this manic guy. THST had been transferred from another unit cause he kept getting in fights over there and all the other patients were trying to attack him. I was still working nights back then and at about 3 AM he came up to me and said his tooth hurt and he needed to see a dentist right away. I said I don't have a dentist for him to see but when the doctor comes in the morning we can't take a look. Gave him some Tylenol and sent him back to bed. About 5 minutes later he came out saying it really hurt and he needed to see a dentist to pull his tooth. Again I told him there's no dentist but maybe I can get some more pain meds. In the middle of me explaining this to him he sticks his hand in his mouth and rips his molar out of his head and handed it to me. Blood starts pouring out of his mouth but he didn't even seem to notice. After I clean him up and get the bleeding to stop and call the doctor to get him some Ativan he goes, "Make sure you give me that tooth back when I leave. That's my tooth, don't try and steal it." Freaking wild crap. I'm a tech at a psych hospital, but I start nursing school in August so I hope this counts. We had a very tall, heavy-set man who swung at a nurse and a fellow tech when they asked him to not stand naked in the door and flash the whole unit. So we put him in a hold and escorted him to the seclusion room. From there he tried to strangle himself with his underwear. He had them on his head like a bandana. So we opened the door and took those away. Then he peed all over the floor, did push-ups and every time he came down he would slurp it up. Eventually he got bored of that and began writing on the wall in his pee, and then masturbated onto the door and said it would be better if He could frick my dead corpse. Eventually his IMB52 kicked in and he contacted for safety good behavior, so we opened the door again and he bit me on the hand and drew blood. From there I got permission to not be involved in the code and a peer swapped me out. I'm assaulted on a weekly basis and we aren't even on acute care facility. I'm very excited to go PRN in August. $15.38 HR is not worth it. Not a nurse, but I used to be a security guard in a hospital and we had a patient who self-harmed and cut a hole into themselves around their belly button and then stuck a bunch of paper clips and buttons and things like that into it. This reminds me of a sequence in Alfred's Playhouse. That behavior is one of the most severe indicators of abuse imaginable. I encourage those affected by childhood abuse comparable events to look into Pete Walker's resources on complex PTSD. Don't do what I did and take a bunch of mushrooms lol. I watched a guy try to remove rats from his rectum. Stated that his ex-girlfriend summoned them there. He ended up tearing his rectal walls to shreds. Pharmacist here. Had a patient getting discharged from the O when they found out 2 police officers were waiting outside to take them in on an outstanding warrant. Patient grabbed the doctor's coffee mug, smashed it on a desk and then tried to slit their own throat with the broken mug. Caused lacerations needing stitches, but luckily nothing serious. We're still arresting you. Not me, but a friend is a behavioral consultant for a psyche ward and once told me a story about a patient that casually approached another patient and proceeded to pin him against the wall and bite his eyelid off. Was interviewing a guy in psych ward and he was complaining about how he couldn't have any whiteout, a liquid eraser for typewriters because he was on suicide watch. Claimed it was stupid because if he wanted to kill himself, as he pointed out, he could use the drawstring from the blinds to hang himself, or he could use his pencil to stab himself, use a typewriter metal bar to off himself. I agreed it was silly to hold back the small bottle of liquid whiteout. When I relayed the convo to my instructor about how silly it seemed due to him having several other ways, she replied that he proved to me that he had been considering ways to kill himself and that's why he was able to come up with so many so quickly. He never did get his whiteout. One of our patients escaped the ward and managed to hitchhike all the way to Sydney, about 900 km. My grandmother worked in a nursing home years back. I remember driving with her the next town over and seeing one of the patients walking down the street in hospital gown that escaped. It is amazing how much energy a 80-year-old dementia patient has. We would put the patient in the car and drive him back to the nursing home. My sister was actually sectioned earlier this year for her eating disorder. She shouldn't have been, but that's a story for another time. And she was right next to the PICU, psychiatric intensive care unit. One of the nights she heard multiple screams coming specifically from that ward. One of the patients had bit a chunk out of a nurse's leg as they were trying to detain them. They then started eating said chunk. It's crazy to think these types of things happen. I saw a girl bite one of the techs, tear out a chunk, then swallow. Yeah, that will stick with you as well. 60-something old woman would come out of her room every so often at night topless and holding out her saggy breasts saying in broken English, "My nipples, nipples, my nipples, please, for the children." 40-something woman would sneak the shower mat out of the bathroom to put under her bed because she was God and we were stealing her power by electrocuting her glory hole every night. The floor mat apparently stopped this from happening. A severely schizophrenic woman used to tell me that my name was the worst fairy tale lie that she ever wrote in the 2 Bibles for her daddy. When she was angry with me she would yell at me and say, "Get out of here, fairy tale book. I wish I never wrote you." That same woman attacked some nursing students who were attempting to use tissues over lollipops to make ghost props for Halloween. She didn't seem to like this and while trying to hit them was yelling, "You idiots. You can't make ghosts out of lollipops." Again, same woman but different group of nursing students brought in several pizzas for an end of semester party. The woman then walked up and down the tables looking at the pizzas. Then out of nowhere she started throwing the pizza and yelling, "What's this supposed to be? Some kind of pizza test? You idiots. You can't make ghosts out of lollipops." This struck me as probably the most lucid sane thing she said. P. We had a Gero psych floor. Crazy old people. One night while passing through, a little old lady popped her head out her doorway and said to me, "I could sure use the company of a good looking young man tonight. Sorry, I'm not that good looking." Quick as snot on a doorknob, she said that's okay. I can't see too well. I didn't join her, but her charisma was on point. Getting hit on by 80-year-olds in the geriatric psych ward whose brains have forgotten what age they are is something they never prepare you for. Some are pretty persistent. Not just dirty old men, dirty old ladies too. I visited a prison for a warden job and went to see the constant surveillance guys. For their own safety etc. There was a fella there who had used a razor to slice his stomach open and started pulling chunks of himself out for fun. He also started using the hole, which wouldn't heal, as a hiding place. A towel was found stuffed in there which his body had started fusing too. Apparently he was quite nice, but the whole thing wasn't for me and I didn't go ahead with applying. Not a nurse, but I was a patient in a psych ward. The ward was sectioned into two sides based on case severity. I was on the less severe side. One night, an incredibly tall, somewhat muscular man escaped his room on the severe side, got through a door that was supposed to be locked, got into the less severe side, and into my room. I woke up, sat up, and saw him standing in my doorway. He asked in a shaky voice if I was alright. I hesitantly said yes. To which he responded by getting a look of terrified horror and screamed, "I knew it. You can see them too. Don't let them get you," before he was dragged away screaming by security. Guess you're protagonist now. Not a nurse, but I had a job that led me to a behavioral health unit of a nursing home. That's what they call psyche wards now, I believe. Some elderly lady scooched up onto the back of a couch, almost standing on it. Think of an old-time cartoon lady seeing a mouse, pointing at me, yelling, "That's him. That's the one." I had that weird panic of being accused, knowing I was innocent, but wondering if I'd be in trouble anyway, despite this being my first time there and me having zero patient interaction other than potential peculiar stuff like this. Then she crazy eats me, my legs. Frick, it was so sad. Then she said she'd give me $1 million not to ever talk to her again. I said deal, and kept moving. Cool under pressure. That's me. Gots to get paid. Not me, but when my sister was in a psych ward for an eating disorder, a girl tried to strangle someone with a bra. Last year my other sister was in there because she was suicidal and a kid tore a water fountain off the wall. Another kid screamed for his shoes, and personally my favorite was a kid whose mother told him he was going on a vacation but instead admitted him into a psych ward. Then he screamed to one of the staff at Lied to me. Thank you all for the comments you've been leaving. Keep the conversation brewing. If my mom told me we were going on vacation and then dropped me off at the psychiatric ward, I'd probably say the same thing. I love my mom, but that's some fricked up crap right there. We tased a guy. He took it like a champ, then pulled out the barbs, handed them back to the officer and told him that wasn't very nice. Had a dude who liked to masturbate, then lick it up off the floor. Another one liked to take a dump, play with it, then go around shaking hands with unsuspecting people. A lady who put sandwiches up her bag. One of my faves though was a guy who one time was walking down the hall, paused, shook his right leg, a turd rolled out onto the floor, then kept walking like nothing happened. I worked in a supermarket and a big jobby was found on the shop floor one day. The leading theory was that someone shook it out of their trouser leg. My ex's mum used to work at Broadmoor Hospital for years. For those unaware, Broadmoor is a very famous asylum for the criminally insane in the UK. She said the strangest thing is how normal the patients were because of all the meds they were on. They're like children eager to please. She met Peter Sutcliffe aka the Yorkshire Ripper numerous times and just said he was nice to everyone, although he was attacked a few times. Her scariest moment for sure though involved this huge fat black guy who'd killed animals and eventually a person by sitting on their chests whilst he'd try his best to watch their faces as they died. Anyway, he was very nice and helpful to everyone, and eventually my ex's mum let her guard down around him. He came with her to get something and as they went into a room he closed the door behind him and just stood there. My ex's mum pressed her panic button that all staff kept with them and then used her training to try and keep him calm and stall for security, but it was no luck as he attacked her. Luckily for her though, there was part of her training at Broadmoor also included some self-defense techniques that even the most smallest woman could employ. Basically she used her finger knuckles to press into the sides of his ribs and he let go of her long enough for her to escape. She did it to me once and I'll side with the crazy fat black guy on this. It's incredibly painful. My sister has been a psychiatric nurse for around 10 years or so and has told me all sorts of stories about her times. She is physically assaulted on an almost daily basis, has been threatened with everything you can imagine. People have thrown, smeared or ingested pretty much every bodily fluid available on the wards. She has just finished a degree retraining as a teacher because she no longer enjoys the profession. Well, that's normal, but it takes a part of you with that piece by piece. Hope she gets well in future life. Not a nurse, but I worked in a group home for teens and one ended up in a psych ward. She was a sweet 15-year-old girl who had been there for about 3 weeks. Plans for the future, would be staying with a relative she liked in a week, had friends, and had no history of issues whatsoever, aside from her mom kicking her out of the house for having a boyfriend, which she was understandably upset about. She went from sane to broken overnight. It was about 1 AM when I found her awake during checks, sitting on her bed and looking upset. She had become convinced she was pregnant, in spite of tests saying otherwise. Then the baby had been changed by chemicals. She was terrified of the baby inside her and the chemicals everywhere changing everything. We couldn't seem to get her to realize she wasn't pregnant, couldn't be pregnant, and she would go on rants about chemicals, but it's hard to exactly what she was talking about. Cleaners, pollution, medication, which she wasn't on. She talked about chemicals getting in things the way some people talk about the devil. All strange, but still just borderline alarming. Then the clock started talking to her and telling her what to do, some of which involved burning herself and knocking her head against the wall. This is when we called authorities. She then basically became incoherent, in a word salad way, and was unresponsive to us. Even when we got between her and the wall she was thumping. It was like we weren't there to her. When she was hauled away, about 4 hours after initial weird statements about how she was suddenly pregnant, she was in a kind of manic but also oddly passive state. Again, like we weren't there, and was unable to walk. She had to be carried out on a stretcher. She was mentally somewhere else entirely. It was terrifying watching herself collapse so quickly and completely. Going to go a different route here as all of the stories seem to focus on the shocking and negative challenging behaviors. I'm not a nurse but I'm a support worker. We currently have a patient who, when he was admitted, was extremely aggressive, not physically, and impatient. He was unable to wait for anything for longer than 2 seconds. Barely spoke to anybody unless it was on a needs basis and couldn't do anything for himself. Fast forward 6 weeks and he has stopped me in my tracks multiple times. The first time he said please when he asked for something. The first time he agreed to make his breakfast himself. The first time he asked how I was when he saw me, and probably the most rewarding of all was when he smiled at me and said good morning. Not a nurse, but used to be a tech at a psych facility. It was my first job out of college. I was left pretty speechless when a teenage girl patient reached over the desk, grabbed hold of the phone, and strangled me with the cord. After several similar incidents, the hospital switched to cordless. My aunt is an OT who works with a lot of brain trauma patients and, sadly, some of these cases are worse than most psych unit cases. One kid had a motorcycle accident at 20 and was in her ward for over a year. In that time he developed hallucinations of a horse who walked the halls and who was antagonistic toward everyone except him. He was sort of gleeful about it, too, like they would be about to leave the room and he would just casually say the horse is right outside. I wouldn't go out there right now if I were you. He's going to hurt you all, with a smile on his face and a chuckle in his voice. Other times though, he'd act as though he was scared of it, too, which given the circumstances was a lot more terrifying. He would also sometimes smear crap around and blame it on the horse. Terrible, terrible story. Rip out their tongue. He was left speechless as well, I presume. I'm a patient at a mental health private hospital at the moment, and one patient that was here brought everyone that had helped him on his journey to get better a rose on his last day, and it was the nicest thing that has happened to me here. I'm a PCT at a mental facility. I have so many stories. Once, we had to put a guy in seclusion, and there is a small inset window to observe them through when in seclusion, and they are on constant observation. The man we put in seclusion was psychotic and targeting me. He stripped naked, violently masturbated towards me staring through the window, then spreads his cheeks and presses his entire butthole against the inset window. It was impressive. I have seen into the all-seeing eye. Had a patient once get a picture off the wall, I don't know how they are bolted to a brick wall, and run down the hallway screaming I'm a cat burglar. I'm the Joker. Another patient abruptly stood up and gave chase screaming I'm Batman. B. Once had a patient crap in his sink because his bathroom door was locked. Someone was on their way to unlock his door, but since it wasn't immediate, he proceeded to crap in his sink. I was doing room checks and saw a pair of legs with pants at their ankles hanging off the edge of the sink. I'll try to add more as I remember lol. I'm Batman. B. Oh my god, yes. Not a nurse but a former patient, on many occasions, who helped out, since I am surprisingly stable even if very weird and uncanny at times. And this one time a co-patient apparently came in with so many fleas, it's amazing. Turns out he didn't wash his hair for the last few months, so besides being oily and heck it was also full of fleas. When asked for why he didn't wash the hair, he reasoned that he didn't want to drown the fleas. I mean, it is solid reasoning but kinda stupid, because you don't wanna have fleas. Whoa, hey, at least he's compassionate. You've been visited by the good sleep capybara. Upvote within the next 5 seconds and you will be blessed with cozy and restful sleep. Like and subscribe, you magnificent person.